Thank you very much, co-chairs. It's a great pleasure to be here once again at our 8th annual MGR Symposium. Of course, this is the major event in our calendar of activities, and one in which the Junior Fellows as a group participate throughout the year to develop for your interest and information. This is, of course, this year's poster identifying the theme, the activities, the speakers, and we're very proud of what's gone on recently because, in fact, the discussion of healthcare in Canada has been going on in this forum for the past 3 years and evolving. We have a trilogy here, starting from a discussion of issues, sustaining systems, and this year we're beginning to address solutions. So this troika of activities does reflect a continuing of thought, evolution in time, and now we present you with the answers to Canadian healthcare system, of course. Well, this is a hat trick of extraordinary achievement by great student bodies, and we have, of course, an evolving leadership in Massey College with our junior fellows participating over time. These activities are guided and punctuated by the participation of a college of mentors. Listed here are the senior fellows and some others who come visit with us, join us for a dinner and a cordial discussion. I list the names here. I won't read them all, but I've highlighted in blue those who participated this year at Massey Grand Rounds activities: John Dick, Siobhan Nelson, Derek Vanderkoy, and Trevor Young, and we are very grateful to our visiting College of Mentors. I should point out that Siobhan Nelson participated in a joint activity with the LEAD program at the Faculty of Medicine, and shortly after her presentation here, she was appointed to the President's Office as Vice Provost, University of Toronto. There's an association, I'm not sure it's causal. Also, MGR as an activity, as a group activity, does require student leadership, and this evolves over time. And you can see over time the way in which the students have participated with a rich alumni who keep in touch. And most recently, I want to thank Lizette York and Sabrina Tang for taking on the job for the past year. And because of the expanded activities and the complexities of the programs, the group decided to identify vice chairs, Kirill Zaslavsky and Adamos, who are here and participating in the program. As you will see, I'd like to thank these folks on your behalf for what they've done and their dedication to activity. None of this, of course, would happen in the absence of sponsors. We're all committed, we all work hard, but there are costs, and there are groups who are encouraging, and I'd like to mention these. First and foremost, Massey College, Quarter Century Funds, Quadrangle Society, University of Toronto Faculty of Medicine, Dean Kathy Whiteside, University of Toronto Department of Medicine, Wendy Levinson, UTMJ, Friends of CIHR, and DRTC, the groups that I'm very much part of. I should point out that this is an extraordinary year. Everything that we do this year is dedicated to commemorate the 50th anniversary of Massey College and the moving on of leadership at the university and the college. This particular Massey Grand Rounds is dedicated in the name of Master John Fraser, who attends this time as his last event in Massey Grand Rounds during his term, but he's welcome to all our future activities. John, you have a pass. I should point out that Kathy Whiteside and Wendy Levinson will be completing their terms as leaders in the Faculty of Medicine and the Department of Medicine, so there's significant turnover all the way around. I'm still around for a year. I still have my office. Master Fraser assured me that at least I have one more year. And so I'd like to point out that we've undertaken to acknowledge our participants, invited guests and otherwise, by giving them the umbrella of support and protection, here shown and modeled by Master Fraser. And I'd like to take these last few seconds to reiterate once again, as I have every year, that these activities that are undertaken by the Junior Fellowship on behalf of the whole is aided, fostered, supported, and encouraged by Master Fraser, as he had over the years. And I've enjoyed it immensely, and I thank you, Master Fraser, for this support over the decade. Please come and say a few words of welcome.
So I'll tell you a secret. I started here as master 19 years ago, and the first year I was here, I think there were 3 medical students at Massey College. It's an interdisciplinary graduate school. It's supposed to foster good relations between the sciences, the humanities, and the professions. But there was a spectacular old senior fellow here named Professor Douglas Pan. He was a former principal of University College, and he was a senior resident here as well as a senior fellow. And I adored him. He was just a wonderful mentor to me when I first came here. And then he was well into his 80s, and cancer started taking over, and he was dying. He was at the Princess Margaret, and I would visit him every day. And every day, there was a former Massey College junior fellow from his many years here keeping an eye on him. And I thought, as I get older and older, if I can survive long enough and I let enough medical students into Massey College, I will be looked after right up to the very end. So we have expanded with the help of Dr. Angel, the number of medical people. We love nurses, we love doctors, and it's all about me and me getting to the grave in a happy way. More seriously, it is a multidisciplinary college. The importance of the grand rounds as they've developed over the years is the way they bring out the multidisciplinarity of all the participants. I think it's spectacular this year that there are junior fellows, a journalism fellow, senior fellows, and all our guests. And I salute Dr. Angel. Dr. Angel figured out Massey College from about the first second he came in here and realized it was a place, a meeting place between town and gown, between faculties, and these grand rounds are very much his invention. He gives me all this credit every year, but in fact, the reins come from him. But I do want to emphasize that it does fit exactly into what this place is supposed to be. It is a wonderful, magical college. And part of my gig coming up every year is if there's anyone out there studying in the health sciences or other places that doesn't know about Massey and is interested in it, there are brochures available in the Porter's Lodge all the way around. If you'd be interested in applying to come to Massey, there's not that many positions, but it's coming up soon. And if you talk to any of the junior fellows here, they'll tell you what life is here. It's a wonderful institution, and the very fact that you are here now is kind of serendipitous. So if the place appeals to you, inquire further. I should just stop. I'm just going to go on talking about Massey College and everything. I should let you get on with the grand rounds, but I'm very proud of this institution. It's been great for the college. I do particularly want to thank the dean. She has been on our side from the beginning, and the collaborative relationship has been wonderful. Wouldn't happen without the support of also the Faculty of Medicine. So particularly, though, it wouldn't happen. He says it wouldn't happen without me. It wouldn't happen without him. So thank you, Dr. Angel. And thank you, all of you.
Just a housekeeping note as we proceed. The proceedings are recorded and they are streamed webcasts and will be online and available on the MGR site. And we are in Twitter communication with the folks in NOSM and elsewhere. So be advised, and we assume that you all agree to be recorded visually and audiologically. Thank you.